Hello all, hope you all are doing well. In the previous videos, I had discussed regarding the homeopathic subjects like what to read and how to read for IPGT. So in this video, I would like to discuss about the allied subjects like what are the important concepts or what are the important chapters. So we'll start with the subject practice of medicine. In practice of medicine, while reading, you have to cover each and every chapter from it thoroughly without any exception because there are two main reasons. One is more weightage. You can expect around 15 questions from this topic, that means from this subject practice of medicine. And if you read thoroughly the practice of medicine, the benefit is that even the other subjects like pathology, surgery, physiology, they can also be covered here because almost the topics are same. There are the same system CVS, CNS, respiratory in all these subjects, but the concepts which have to focus in different subjects are different. But anyway, 80% of pathology, surgery, physiology will be covered here itself. And while reading practice of medicine, you focus especially on some key concepts like what are the sensitive and diagnostic tests for important diseases, characteristic signs and symptoms of that particular disease, criteria for disease diagnosis. Coming to pathology and microbiology, in pathology, the most important chapters include cell injury, cellular adaptations, inflammation and healing, immunopathology, neoplasia, disorders of leukocytes and lymphoreticular tissues, and other systemic chapters. The systemic chapters are already covered in the medicine part. And while reading pathology, you focus on some concepts like what are the inclusion bodies in that particular disease, what are the pathological findings, that means important pathological findings, and also pathogenesis of important diseases. And in microbiology, you focus on sterilization and disinfection, hypersensitivity. These two are most important. And coming to bacteriology, while reading any bacteria, you focus on its key features like its gram staining, what is its shape, that is morphology, whether it is aerobic or anaerobic, and what are the toxins produced by it, and what are the diseases caused by it. And the same applies to biology and mycology. In physiology and biochemistry, the chapters to be read in physiology are already covered in medicine part, so no need to go again. And in biochemistry, you focus more on proteins and amino acids, enzymes and vitamins, and metabolism, especially of carbohydrates, lipids, and amino acids. For subject anatomy, please don't stress much. You focus on few areas like what are the important foramens in the body and the structures passing through it. Second, important triangles with its contents and boundaries, and important arteries, veins, nerves with its branches and relations, and finally important muscles with its nerve supply and clinical anatomy. Next, in FMD, you focus on chapters like Indian legal system, medical law and ethics, identification, thanatology, mechanical injuries, mechanical asphyxia, forensic psychiatry, sexual offenses, and finally toxicology. From surgery, the systemic portion already been covered in POM part, that is practice of medicine. So you can read there, and along with that, you go through the topics like wound, keloid, scar, ulcer, infections, breast, oral cavity, thyroid, and finally hernias. From ophthalmology, you focus on glaucoma, cataract, diseases of conjunctiva, retinoblastoma, diabetic retinopathy. From ENT, you go through what is Meniere's disease, acoustic neuroma, cholesteatoma, otosclerosis, otitis media, nasal polyps, sinusitis, diseases of salivary glands, and tonsillitis. From orthopedics, you focus on fractures like what is its classification with healing, and fracture of different joints and bones like clavicle, shoulder, surgical neck of humerus, elbow, and hip with Colles and Smith's fracture. And also focus on bone tumors, TB of bones and joints, arthritis and degenerative disorders, and finally soft tissue affection. From PSM, you go through man and medicine, concept of health and disease, epidemiology, communicable and non-communicable diseases, demography and family planning, nutrition and health, environment and health, occupational health, health planning and management in India, communication for health education, international health, health information and biostatistics, preventive obstetrics, pediatrics, and geriatrics. From gynecology, you go through congenital malformations, puberty, menopause, STDs, uterine displacement, infertility, uterine fibroids, endometriosis and adenomyosis, pre-malignant and malignant lesions, urogynecology, and fistulas. From obstetrics, you go through placenta, diagnosis of pregnancy, fetal skull and maternal pelvis, ANC, prenatal genetic screening, normal labor and puerperium, disorders of amniotic fluid, placenta and cord, eclampsia and eclampsia, APH, PPH, diabetes, anemia, hypertension during pregnancy, preterm labor, PROM, IUFD, complicated labor, prolonged labor, disease of fetus in newborn. So these are the important chapters from different subjects from a lead part. So you go through them thoroughly without missing any point, where you can score at least 80 to 90% of marks from these chapters, because these chapters are selected on the basis of their on the basis of like previous question papers in IIPGT, in UPSC, and even state PSC's question papers. So go through these chapters carefully without missing. If you want to join in our free coaching WhatsApp group, that is IIPGT free coaching WhatsApp group, the links are given in description, so you can join through that.